Hi, everybody. Welcome to We Can't Do This Alone. I'm your host, Erin, and welcome to episode 2, The Truth About Physicians and Philanthropy. As I mentioned in my intro episode, working with physicians, it's a huge part of who I am. It's something that I've done in my entire career, 20 plus years in healthcare philanthropy. And working with physicians, it's not just probably the most rewarding aspect of my work, but it's also the most enjoyable. That being said, there's a lot of misnomers out there around the notion of working with physicians in philanthropy. For example, the media can sometimes paint this in a negative light. Every couple of years, for example, the New York Times will publish an article about grateful patient philanthropy. And in that article, it might put in a negative connotation, the fact that hospitals might expect physicians to help them raise money. JAMA, for example, drops studies every so often, I'd say probably every year or two, that again surveys all kinds of physicians and puts this work in a light that may not be super positive. And so obviously I feel differently about this. Working with physicians, it's not only rewarding, but I have found physicians to be some of our best philanthropy partners. It's half the reason why I'm starting this podcast. And so I wanted to take this episode to go through some of my favorite myths around working with physicians in philanthropy that I have found not to be true. And, where do these opinions come from? Well, I'll share. So I think I mentioned I started my career in healthcare philanthropy 20 plus years ago. And my first role at a healthcare organization here in Columbus, Ohio, a Catholic healthcare organization, my first role was the event planner. And through that, I found myself working with a group of incredibly generous physicians and their wives, planning our gala. We started a physician award, and it was through this work very early in my career. I was 22 years old, working with some of the most generous physicians that I've ever met to this day that solidified my path to wanting to work with physicians in philanthropy. Fast forward, again, I spent 12 years at that institution where I worked with a ton of amazing physicians as philanthropic partners, not just as donors, but also as volunteers who would come alongside me when we raised money for our campaigns and other things as true partners in helping raise funds. 10 years ago, I joined Accordant Philanthropy, a consulting firm, and through that work, I have been so lucky and honored to almost pretty much solely focus around helping organizations implement grateful patient programs and helping organizations implement strategies on becoming closer partners with their physicians. And so through this work, I have interviewed over 400 physicians all across the country about philanthropy, about their views on working with the foundation and their views on helping introduce grateful patients to the foundation and how they might be able to better partner with the foundation. Of those 400 doctors I've worked with, I've been able to formally train about half that many around how to spot patient gratitude and how to better partner with the foundation to raise money to benefit their area and to benefit the community. And so it is through this work and all of these conversations that I've had in working with so many organizations across the country that I've formulated many of these opinions that I'm going to share today. So let's get started debunking some of my favorite myths around working with physicians in philanthropy. The first being one of my absolute favorites, that physicians just don't have time to work with the foundation. Okay, yes. Physicians are incredibly busy. They are probably amongst the busiest people in our healthcare systems, in our hospitals. We are not debating that. However, I have found that when the physician wants to partner with you, when they are passionate about what you're raising money for, when they have raised their hand and stepped up and said, I want to help, I want to give of my time, I have found that they will make the time to do this. Let me give you an example. So last summer, I traveled all the way across the country to a client in Oregon and to work with this incredible client. And then in the evening, the foundation set up a dinner between our executive director, myself, and one of our biggest physician champions. So this doctor, she was an incredibly busy trauma surgeon. And, just a wonderful champion for philanthropy, a wonderful person. And she kind of comes rushing into dinner. She was a couple minutes late. Gosh, who cares? And she sat down and she said, gosh, I've been in clinic all day. I probably have 3 hours worth of charting to do later. I hope I can even remember everything I need to put in the chart. But I really wanted to be here at this dinner because I care about this. And so there you have it. Time and time again, yes, physicians are busy, but when they care, they're going to make time and they're going to show up. Just like you and me would. If it was something that we cared about, we will figure out, make the time to show up. Let's start with another one. And so this is about physician burnout. So if you are in the healthcare industry, you know that physician and clinician burnout is honestly one of the biggest issues plaguing our industry today. So, before the COVID-19 pandemic, physician burnout was already a huge issue. Then going through the pandemic it compounded the situation, compounded this issue even further to where this has actually become national news. And again, I mentioned I am talking to doctors all the time, talking to service line leaders, executive. I always ask folks, what keeps you up at night? What are the biggest challenges you're facing? And 9 times out of 10, they're going to say physician, clinician, nurse burnout. And so therefore, one might think physicians are too burnt out to work with philanthropy. Well, and again, nobody has debated physician burnout being an issue. I actually just pulled up Medscape's annual physician burnout survey. So every year they publish, it's a great resource if you're in the healthcare industry. And every year they survey about 2,500 physicians about their burnout levels. And I just looked, and last year's report indicated that over half of physicians are indicated either being burnt out or depressed or both. I think the number was 53%. Again, 53% of doctors indicating either being burnt out or depressed or both, which is horrible. Now, again, in philanthropy, we need to remain absolutely aware of these issues. Meanwhile, when the physician has signed up, raises their hand, says, I'm going to work with you, I'm going to be your partner, I'm going to meet with you, I'm going to schedule with you on a regular basis, I'm going to attend a training, I'm going to work with you together to raise money, typically that physician is not burnt out if they're going to step up and give you of their time. It's funny, as I said, I work with hundreds of physicians and I know burnout is a huge issue, but I myself, I never see burnt out physicians because again, if they're going to take the time to meet with me, I'm a consultant, or to come to a training or to work with the foundation and meet on a regular basis with their gift officer, they're not burnt out. And so again, it's really, really key that we in the industry understand the issue and we understand what's going on and we are aware that it's a huge issue in our organization and that it's most likely a top priority with your institution actively implementing strategies to combat this burnout. But when it comes to working with physicians in philanthropy, typically they're not going to be burnt out because if they were, they wouldn't want to work with you. Issue/myth number 3. This one is about HIPAA. So the myth being physicians don't want to work with philanthropy because they're worried about HIPAA. They're worried about ethical issues. So, little background on HIPAA, the Health Insurance Portability and Accountability Act. It was enacted in 1996, all about patient privacy. And in this, it is always stated that healthcare philanthropy could have access to patient information for philanthropy purposes. Back then, we could have access to patient demographic information for fundraising purposes. In 2013, this law actually relaxed. So through the HITECH Act, the law relaxed and said, instead of just demographic information, we're also going to give you access to the patient's physician, their treatment location, their service line, and their outcome. And they said, because we're giving you this information, you just need to be a little bit more communicative on the patient's ability to opt out. Make it visible, make it easy for the patient to opt out. And so this was a huge game changer in healthcare philanthropy because it really elevated our opportunity to work with physicians as partners to raise money. But it also put into question, is this ethical? Is this going to make the physician treat their patients differently or interfere with that trust that they've built? And so, it's interesting, again, over time. And so I've been working with physicians for at least 15 years directly in philanthropy. And I can say feasibly so that I really don't see this issue. So I know for a fact in 2020, it was either 2019 or 2020, the advisory board company published a study. They interviewed, I think, about 250 physicians. And the study was called Why Don't Physicians Work with the Foundation? Something to that regard. And the number one answer was not about HIPAA. In fact, this study only indicated about 20% or less of the physicians interviewed indicated HIPAA as a reason why they wouldn't want to work with philanthropy. The number one answer was actually, I'm not working with the foundation because no one asked me to. Isn't that interesting? But however, going back to this issue around HIPAA and ethics, again, as I've said, I really don't see this. And again, going back to I've interviewed hundreds of doctors, this truly doesn't come up. If it comes up, very much philanthropy officers are typically trained in HIPAA just like anybody else is. And the law is blatantly clear. We are allowed access to patient demographic information for fundraising purposes. We're allowed to work with our doctors, and we want to treat the patients just like they would. And so again, this sometimes I get asked, do doctors worry about HIPAA? My answer is no. Typically, they don't. Number 4, this is quite frankly one of my favorite things to talk about. It is also one of my biggest pet peeves in healthcare philanthropy. And this is around the notion of physicians as donors. Okay, so what is this myth? Well, the myth is my physicians need to be donating to the foundation in order to work with them as a partner. Well, first, let's go back and look at this notion of physicians as donors in general. And so, a lot of times, and again, I've been guilty of this myself, it's easy to look at a physician in your organization and say, you would be a great donor to the foundation. You work here, you probably drive a nice car, you have means, absolutely. You should be giving to the foundation. Well, if you've ever heard me say this, and I'm going to say it again, just because somebody drives a nice car and works at your institution does not mean that they are going to want to make a gift. Physicians or anybody, any employee, any executive for that matter, needs to be cultivated just like any other donor or prospect. Physicians need to be cultivated too. They are not just going to make a participatory gift to the foundation just because they work there. And so let's talk about physicians as philanthropy partners. And so when we look to work with our physicians, we seek their help in introducing us to patients. Again, they're hearing gratitude at the bedside. We are not. Their ability to introduce us to those patients is huge. We look to them to speak on our behalf. They know why philanthropy is needed much more than anybody else in the institution and can speak to that in a way that the community is going to understand better than if you or I were to speak about that, because they're on the front lines providing that care. Their ability to build relationships with patients, as we can see, patients love their doctor, they love their clinical providers, and typically when the patient wants to make a gift, they're essentially giving it to that physician. They want to make that gift and honor their physician, and they want others to be helped the way that they were helped. And so a lot of those things I just mentioned that the physician is going to do, that has nothing to do with giving money. That is giving of their time and talent. And philanthropy is time, talent, and treasure. It's not just about money. And so I always say, If the physician is going to give you of their time, if the physician is going to take the time to meet with you, to review lists, to strategize with you, if the physician is going to lead a tour for you, or if they're going to speak on your behalf at an event, or if they're going to meet with a donor with you, the impact of that time is exponentially more impactful than the physician making a participatory gift. It just is. Now, again, going back to experience, if the physician isn't a donor, more times than not, once they start working with you and learning about the foundation and partnering with you and seeing that impact, 9 times out of 10, they're going to start giving themselves. And I'll also say on the flip side, say you have a physician who's been a longtime donor to the foundation, you might automatically think, oh, this physician's going to be a great partner. Well, many times they are, but that doesn't necessarily always translate. So again, we've got to look at everybody's unique. Every physician is unique. We don't want to make assumptions. And again, harping on the fact that they can be a wonderful partner. They should not be written off if they have not yet made a gift to the foundation. And don't forget to cultivate your physician prospects before you ask for that gift. Let's look at number 5, another personal favorite. Actually, I keep saying every one of these myths is my favorite, but truly, I feel that they're also important. Okay, myth number 5. Physicians must make referrals of their grateful patients in order to be a great partner. Now, if I would have said this 10 years ago, the olden days of grateful patient philanthropy and clinician engagement, that might have rang true. For the past 10, 15 years, when we think about physicians and philanthropy, the goal has been, just like I said, making introductions of their patients because they're at the bedside hearing expressions of gratitude from patients and families, and we are not. So they can essentially introduce us to patients, refer them over to make that introduction so we are alerted to the fact that we have a grateful patient, and the fact that the physician makes that introduction makes it a very much more warm call. And our ability to connect with that patient is going to be a lot better knowing that introduction came from the physician. However, in the real world, I can't tell you the number of times that I have encountered a physician who may be a little bit gun shy about making those introductions. When I say gun shy, I mean a little bit hesitant. Obviously, doctors aren't trained in medical school to work with the foundation. Doctors are not trained when they're hearing gratitude to think about the foundation. And so it takes a lot of time to help the physician understand why this is important. We have to help the physician suggest things to say when having this conversation. And at the end of the day, sometimes the physician isn't going to be comfortable with it, or they just might not have time to do it in the moment, or they just don't want to do it. So does that mean we should write them off as philanthropy partners? My answer is a resounding no. Let me tell you a story. So a couple years ago, we were working with an organization with 9 hospitals. They were in a $100 million campaign, and cardiovascular care was the top priority of their campaign in all of their markets. In their flagship market, cardiovascular was the top priority of the flagship market within their campaign. So, of course, we look to our cardiovascular leader. So we approached our physician chair of cardiovascular for the whole state, all 9 markets. He's a wonderful physician. He had been at the organization a long time, just a wonderful person, has so many grateful patients. And he said to us, I am just not comfortable making referrals. I'm not comfortable introducing you to my patients. I just can't say it at the bedside. I just can't do it. I'm just not comfortable. So we said, okay. So now, in the olden days, we may have just wrote him off and say, well, we can't work with him. But the fact of the matter remained, we needed to work with him. He was the head of cardiovascular for the whole state, as well as our biggest campaign priority. And so we had to really examine, okay, we really need him. How are we going to engage him at a level that he's comfortable with? And so we said to him, okay, doctor, it's fine. If you don't want to make referrals, will you speak on our behalf instead? Will you share why the cardiovascular campaign is needed? Will you share why philanthropy is needed to support this incredible program that you are leading? And he said, you know what? I think I can do that. And so fast forward a month, we planned what I like to call a physician feature event or a salon event, meaning a small in-home donor event where typically a board member or somebody else will offer up their home and you invite an intimate number of folks. So sweet spot, maybe 20 couples, 15 to 20 couples. And so that's what we did. And this physician was going to be our speaker. We also invited his patients, and he said, I'm not even comfortable telling you who to invite of my patients. You can look at my patient list and decide for yourselves. I trust you to get the right people in the room. And so we did that. We screened his patient list, identified 15 to 20 couples to invite. And it was really cool because a lot of these folks, they had never been engaged by the foundation before. They had never interacted. They'd never donated to the foundation. And many of them came. One I can remember had called the foundation, a patient of this doctor, and said, I am so honored to be invited to this, to see this doctor speak. So many attended this event. Again, small and intimate, but we had a great turnout. This physician spoke. It was incredible. We had people leaving this event saying, I finally understand your heart program. And after that, we didn't make an ask at this event, but we followed up. And several of the folks who attended made a gift. I think we got even one $5,000 gift, which is a wonderful first gift for somebody who's never engaged with the foundation before. And more importantly, this physician had a very positive experience working with the foundation. Mind you, he was hesitant and he said, I don't want to make referrals, but we decided we engaged him in a different way that he was comfortable with. And we made sure he had a good experience. And now we like to call him a speaking machine. He's spoken at several other events for the campaign and others. He's one of our best physician partners. And he is our best physician partner, even though he's not making referrals. And I'm here to tell you that that is okay. There's a lot of ways physicians can be engaged in our work. It's all about what they're comfortable with. And if they're not comfortable doing something, we have to be okay with that, because if they're not comfortable, they're not going to do it. And so we don't even want to waste our time with that. We need to have the conversation right off the bat with our physician partners. Tell them, here's the different ways that you can help us, and see what they are comfortable doing. Because they'll tell you, they're not going to do something they're not comfortable with. And so, fact of the matter being, just because a physician doesn't want to make referrals doesn't mean we write them off. They can still be incredible partners for us. Here is another big one. I need a lot of physicians. We need a ton of physician partners to be successful at this work. So this is one of the more prevalent issues that I come across. Organizations, foundations thinking, I need to engage a ton of physicians. The more, the merrier. It is about quantity. We've got to engage our whole hospital. We need to engage every physician in this service line. We need to train as many doctors as we can. Well, again, we're debunking myths here. So let me state that this is absolutely not the case. Time and time again, in case studies, for example, that I have read, case studies that I've written, projects, client work that I have done, where we have set out to purposefully engage physicians in philanthropy, developing those true partnerships to increase patient giving and just increase giving in general at our healthcare institutions. Time and time again, it is so much more about quality, not quantity. You don't need a lot to raise a significant amount of money. For example, one of our case studies that I share and talk a lot about, and I promise I will be bringing some of the players in this case study onto the show as guests, both executives and physician leaders who are part of this case study. But this is a hospital in Tampa, Florida, where they were in a $100 million campaign. I'm pretty sure they raised $200 million, not even $100 million. But they, at the time, we had this case study, and the time that we were working with them, they had 3 gift officers assigned to oncology, transplant, cardiovascular, women's and children's, where we found physician partners for each service line, and the gift officers began building relationships with these doctors and building strategies to partner, whether that be through referrals or doing salon events. Fast forward, this institution is raising about $20 million a year from patients and families through partnerships with their physicians. And when I speak about this, I always ask, how many doctors do you think it takes to raise $20 million from patients? Well, at the time, again, I don't want to misquote recent, but as of 2 years ago, for example, they raised $17 million from patients and families working with about 20 doctors. 20. That's it. With 3 or 4 gift officers working with maybe between 5, 7, 10 doctors each. We don't need more than that. And there's a couple of reasons for that. First and foremost, there's no way we could ever be successful at engaging hundreds of physicians at our institution. Secondly, again, we just don't need to. It's all about finding the right physicians and working with them and building those relationships. And so, too, if you're going to be many in philanthropy, we wear a lot of hats. We have a lot of responsibilities. So to do it right, we really have to put a lot of focus and effort and energy into building these relationships. It's very much like building a relationship with a major donor, which anyone in major gift fundraising know it takes an extraordinary amount of time and effort to build a relationship where you're able to ask for a gift. Well, it takes an extraordinary amount of time and effort and purpose to build a relationship with a physician who, again, you're not asking the physician for a gift, but you're asking this physician for their time and their talent. And so building that working relationship where they're able to meet with you, introduce you to patients, speak occasionally, or maybe, send a thank you letter to a donor, all the things that these physician partners can help us do. It takes time to build that relationship, and it takes time and effort to manage that relationship. And so a good gift officer, we can't handle more than 5, 7, or 10 of these relationships. Well, you're going to ask, how many should my organization aim to engage? Well, my rule of thumb, and again, I'm not the end all, but I typically like to say for a new philanthropy officer, if you're brand new to major gifts, or if you're brand new to healthcare, which a lot of our organizations do have brand new gift officers, even finding one physician to partner with is going to make a huge difference, and it's not going to overwhelm your brand new gift officer. If you're more experienced, or you have a little bit more tenure or a little bit more experience in healthcare, you can go up to 3, 5, 7. I would say absolutely draw a line in the sand. A gift officer should not be working with more than 10 physician or ally relationships at a time. Anything more than that, you're not going to be able to put your full effort into doing things right and building and managing that relationship in the most successful way that you can. Again, we want to look at quality, not quantity. This is never a numbers game. We don't need to engage a ton of physicians to be able to do this successfully. We just need to find the right ones. And I promise you that you can. Last but not least, and this is probably my favorite one to talk about of all time, and being that the myth being physicians don't want to work with philanthropy. Well, again, as I stated in we were talking about HIPAA through the advisory board study, indicated that the number one reason why physicians don't want to work with philanthropy is that nobody asked them to. But aside from that study, I can give you so many examples of why this doesn't hold true. First of all, let's look at research and data. So last year, Press Ganey published an article looking at the survey results of thousands of physicians, because they do a lot of physician engagement surveys, just like they would do employee engagement surveys for your company or your healthcare institution. And through looking at this data, it found that 80% of organizations that have low physician alignment also have low physician engagement. So what is physician alignment? That being the physician feels like they're part of the decision making. They feel like they have a say. They feel like they are part of the future and the vision of the institution. And this is so important. At Accordant, we help many healthcare institutions do campaign feasibility studies. And when we do those feasibility studies, I always interview the doctors. And we're always asking them, do you feel like you're a part of the vision? Do you understand the vision? Were you asked to provide input on that future and that vision? And if a lot of the physicians at the organization say no, we have to take that into account. Because again, when you're looking for volunteers to help lead your campaign, we want folks who feel like they're a part of the vision in the future of the organization. And if you didn't get a say, then that's not going to sit well. And so when we think about, I bring this up because physicians, just like anybody else, they want autonomy. They want to have a say. And oh my gosh, working with philanthropy, what better opportunity to help drive change at your organization? When partnering with philanthropy, you can dream a little bit. You can see some of these projects that if we raise money for them, we can bring something new to this hospital and to the community that didn't exist today. Doctors, they want this alignment. They want to have a say. They want to be a part of the vision and the future of the organization. And many, many, many physicians understand that through partnering with the foundation, they can also achieve this. Also, on this issue, I can't tell you the number of times where I've had a conversation with a physician about potential partnership with the foundation. And when we talk about it and explain how, making an impact, figuring out partnership as far as let's raise money together for something that's going to benefit you or your patients or their families or the community. I can't tell you the number of times the physician will say, for example, thank you so much. This is bringing me back to why I got into medicine in the first place. When a doctor says that to me, which has happened many, many times, then you get goosebumps, right? Or sometimes many physicians who are maybe a little bit older at the latter half of their career, they will say to me, you know what? This could be my legacy. I love this. I want to help. So we think about time and time again, asking our physicians to come be a part of what we're doing. Many, many times they want to step up and help. Just this week, I was in New Mexico at a client where I spent 2 days training physicians. So we had identified physician partners. I interviewed them to vet their willingness to learn more about partnering with the foundation, which many of them said, absolutely, I'm interested in this. I want to help. And then flew out to New Mexico and we did formal training. And so when we do this, we ask for 45 minutes. So we do about a half an hour training presentation, and then we leave 15 minutes for questioning. Well, so over the 2 days, I think we trained between 10 and 15 physicians. And these are surgeons, these are oncologists, they're leaders of their departments. They're not just taking care of patients, they're also in administrative roles, many of them. And let me tell you a couple things. First of all, I don't think one physician no-showed. So that means they were scheduled to come to one of the trainings and they didn't show up. Every single one of them came to the session that they were scheduled for. Let me tell you another thing. I don't think any session ended before an hour. So again, we asked for 45 minutes. We do the training. But it was so cool because so many of these physicians, they were interacting during the education. They were asking questions. And then following the actual training, we were having the best discussions about what they were being asked to do, what this could be for the healthcare system, how excited they were that the healthcare system was investing in this, how excited that the healthcare system was opening the door to start this type of work, to build these partnerships. We even had one of the physicians, he literally stood up and was so excited about the notion of partnering with philanthropy to raise money for his service line. And so again, this is not uncommon. This is what happens most of the time. And it's interesting, going back to when at the beginning of this episode, I mentioned, for example, the New York Times will drop articles every few years that paints this work in a negative light. And it's funny, when I read these articles, nowhere does it talk about patient gratitude or the fact that donors or patients might want to give, which we can talk about that in another episode. But the other thing that I always chuckle about in my head is that, so I'm a mom. I have 3 kids. I have twins in 4th grade, and my beautiful older daughter just turned 13 last week. It's funny. I can't force my children to do anything. How would I ever force a busy doctor to come partner and work at the foundation with me? It's just not going to happen. Any doctor that I've ever worked with wanted to help. He or she wanted to come to the table. He or she said, I care about this. I care about philanthropy at this institution. I'm going to make time for this, and I want to help. And so again, when we approach it in this manner, and when we work with our physicians to identify what they're passionate about, and we have the conversation of, here's some different things you can help us do. What are you comfortable doing? 9 times out of 10, they're going to say, sign me up. I can do this. I want to help. That was my big old list of myths and misnomers when it comes to working with physicians in philanthropy. Again, I love talking about this. I love to debunk these myths. I love to share the positive experiences that I and all of my colleagues and clients around the country have had in working with physicians in philanthropy in an incredibly positive and impactful way. I would love to hear from you. If you can think of something that I didn't think of, please feel free to shoot me an email at Erin@wecan'tdothisalone.com. Maybe there's something that you've encountered that I didn't mention. Or again, if you've got a story, a success story about working with a physician, I would love to talk to you about sharing that experience and coming on the show. Thank you so much for listening. Next week, we're going to start bringing on our guests. I hope you will tune in. And again, thank you so much for being with me today. This is We Can't Do This Alone. I'm your host, Erin Stitzel. And from the bottom of my heart, thank you so much for being with us today.